Now let's focus on the tibia, the main weight-bearing bone of the lower leg. We'll start at the proximal end, near the knee. At the top are the medial and lateral tibial condyles. A condyle simply means a rounded, knuckle-like surface. Think of them as the parts you could almost grab. These condyles support the femur above. Covering the top of each condyle is the tibial plateau, the smooth articular surface that allows the femur to glide during knee motion. There are two plateaus, one medial and one lateral. Between them is the intercondylar eminence, a raised area that helps stabilize the knee. Just in front of and behind it are the anterior and posterior intercondylar fossa, shallow depressions where the intrinsic knee ligaments, including ACL and PCL, attach. Moving slightly down the front of the bone, you'll find the tibial tuberosity, a large, obvious bump used to orient the tibia. This is where the patella ligaments attaches, transmitting force from the quadriceps to extend the knee. The size of the tibial tuberosity varies. Greater mechanical stress from strong or frequently used quadriceps can lead to a more prominent tuberosity. You can easily feel it on yourself, just below the kneecap. Now let's look at the shaft. Along the front is the tibial crest, also called the anterior border. This is your shin. If you've ever hit it, you know why it hurts. There are many pain fibers in the periosteum covering this ridge. On the back of the shaft is the soleal line, a diagonal ridge that marks the attachment of the soleus muscle, an important muscle for standing and walking. At the distal end, near the ankle, the tibia forms the medial malleolus, the inner ankle bone. This structure helps stabilize the ankle and serves as an attachment site for parts of the deltoid ligament. On the bottom of the tibia is the inferior articular surface, a smooth area that articulates with the talus to form the ankle joint. On the lateral side, you'll find the fibular notch, where the tibia articulates with the distal fibula. In summary, the tibia articulates with the femur at the knee, the talus at the ankle, and the fibula along its lateral side, making it a key bone for support, movement, and stability.